So Americans who are uninsured now have another 3 months to buy the Affordable Care Act coverage. Special enrollment runs through May 15th. Can anyone without insurance sign up for Obamacare? Is there a criteria for eligibility, Paul?
Yeah, anybody can sign up now. Normally we do that at the end of the year. And if it's not done at the end of the year during the normal open enrollment period, you have to have a qualifying event, loss of other coverage, birth, death, marriage, divorce, some of those things. So what they've done is open it for another 90 days, February 15th to May 15th, without a required event like that for anyone to sign up.
So let me ask you this. A lot of people don't know if they're eligible or not. If you were offered insurance through your workplace, can you shop for insurance on healthcare.gov to see if there's a better deal?
You can, although it could affect your ability to get a subsidy. So, but when you go through the questions there online, it'll kind of work you through that, and you can determine if you are eligible or not for a subsidy. I think the intention of this additional open enrollment window is to pick up some of those folks that maybe lost coverage to their employer. Although they would have had an opportunity to enroll at that time, perhaps some of them weren't aware of that or just didn't choose to enroll at that time. And if you're a single person with an income up to $51,000 or a family of four up to $104,800, likely you're going to get a subsidy or even have all of the premium covered.
President Biden is working on a stimulus plan. Is anything covered for the Affordable Care Act within that plan, or was it under one of his executive orders that was signed earlier? How is this helping people?
Yeah, the executive orders did include some action on health care. The long-term goals of Biden Care, that I guess is what we're going to start talking about going forward, is to add to the subsidies of Obamacare. So essentially expand access to insurance, increase the income limits, so make subsidies available to more people, more Americans. Another idea that they have is to lower the Medicare age to 60. That one will be a little tougher. Both of those would require some legislation, so they're not going to be the result. They're not going to implement as a result of an executive order, although they are goals. The Medicare currently is on track to be insolvent by 2024, so lowering it to age 60 is likely tough without reworking how we're funding it. But the main goal is to add acts of the executive order. The main substantive action so far is to add this new or additional enrollment period here for the next 90 days. Otherwise, it's going to take some legislation to get things done. And the overall goal of Biden Care is to expand access and get a public option if possible.
I think it's very interesting. I think a lot of people that are offered insurance at their workplace, they automatically think they need to accept that. But I guess in this case, if some of the income levels are a little bit higher, you could actually shop for yourself on Obamacare or Biden Care now.
You could, although the one thing to be careful about is the fact that if your employer provides what's considered an affordable option for you, where it's not, you don't have to contribute more than a certain percentage of your income, 8, 9, 10%. If you're not having to contribute more than a certain percentage of your income, then the subsidies may not be available to you. So just fill all that stuff out truthfully, knowing that if it can come back and kind of bite you if you fail to complete things